Hello, 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 Facebook. I am Dr. Myla Bennett of Adarabella Plastic Surgery and Medical Spa in Johns Creek, Georgia. And I wanted to come on tonight to talk about safety and selection of your surgeon. And part of the reason why, hey, Allison, part of the reason why I decided to have this talk tonight, I've had this talk a few times before, but there were 2 deaths that I'm aware of in the last 5 days. 2 women died, one in the United States, one in the Dominican Republic. And then I saw in one of the surgery groups that I'm in, the tummy tuck groups that I'm in, one lady was life flighted to a hospital to undergo emergency surgery for a bad infection after she got a tummy tuck. And then one of the ladies who commented in there mentioned her surgeon, and I looked that person up and they're not a surgeon. And it's just so much of this going on, and it's just frustrating because I think people just don't either. I know that some people just ignore the facts, and then there's some people who just legit don't know. You can have complications with a real plastic surgeon. And you can have a death with a real plastic surgeon. But it seems that the places that have the most deaths and the most horrific complications are the places where it's not real plastic surgeons, or the places where the people are highly unethical and it's obvious. So I just wanted to kind of review this stuff again. And I know everybody's not going to take heed to it, but this is for the people who are actually interested in knowing how to safely choose, and interested in knowing some of the things that people do to trick you into believing that they're qualified when they're actually not. Because when I went and looked at one of those doctors' pages, I was so angry. I mean, if you look at his page and you don't know any better, he seems like an expert, like that's the best place in the world you should possibly go. And the man is a family practice doctor, and his website and his fake training and all the other stuff makes it look like the person would be in great hands, and they are so not. It was just really, I was just like flabbergasted at the depths that this person went to make it seem like they were the most qualified. And to a lay person, like if I didn't know what I knew, I would see myself thinking that was the place to go to. It just makes me sad. So I never call out doctors because I'm not trying to like do the whole libel, slander, defamation thing. So I'm not gonna say anybody's name. I'm just gonna say what you should do to look for somebody, and how you can know for sure that it's a real plastic surgeon. And then it's up to you to listen to what I say and take it, have it in the front of your mind when you're doing your research. I'm not naming names. I'm just gonna name circumstances and situations where you should leave or not do it, even if you put down a deposit that you can't get back. Because 2 people that I'm aware of died this week. It's ridiculous. The first death that I heard about this week was actually she went to a real plastic surgeon, and from what I could find, it was an ethical plastic surgeon. And usually most of the deaths that I've seen in the last few years, the majority of them were as a result of people getting Brazilian butt lifts. And this lady wasn't getting a Brazilian butt lift. She got a tummy tuck. And we're not sure what it is. There were not like reports about it or anything. I saw it in the surgery group, and a few people DM me about it, but nobody had really real information as to what happened. The first lady, all I know is that she had surgery one day and she died the next day. And I know that she got a tummy tuck. She had lost a lot of weight, and then she got a tummy tuck and she died the next day. Some of the reasons why a person could die from a tummy tuck. Let's say, you're in the doctor did everything they were supposed to do. The surgery went the way it was supposed to go. The patient was healthy. Like, she didn't hide any information. Some of the things that could cause you to die from a surgery when everything goes the way it's supposed to, like when you as a patient do all that you're supposed to do, the doctor does all that they're supposed to do, and it's just one of those things where you were just unlucky, is a blood clot. Blood clot formation happens sometimes despite, our efforts, despite the fact that there was no signs in the person's medical history or family history that they were prone to blood clots. And with tummy tucks, that particular surgery has a higher rate of blood clot in the leg formation compared to other cosmetic surgeries. And part of the reason for that is the muscle repair. It makes the blood flow return from your legs harder because your abdominal cavity is under more pressure after the muscle repair. Now, the blood clot itself doesn't cause you to die. But if the blood clot breaks off in your legs, and it's a large one, and it breaks off in your legs and it goes up to your lungs, a large blood clot that goes up to your lungs and blocks everything off is called a saddle embolism. Or it's a form of a pulmonary embolism. It's like one of the most severe type of pulmonary embolisms. And if she had something like that, that could have caused her to die the next day. But I don't know why that lady died, because nothing else, basically it was reported that she died and that was the end of it. Nobody said anything else, so I'm not sure. So one of the things that I do, and a lot of surgeons do, sorry y'all, it's late, to try to prevent that is put the patient on blood thinners when they get a tummy tuck. And that's kind of one of those things too that's kind of, I won't say controversial, but it's not like something that every plastic surgeon does. And if your plastic surgeon didn't do it, that's not wrong, because there are risks with putting people on blood thinners when they're getting surgery. So you kind of have to like weigh it out. And that's the thing, like people, it's not an exact science. Like you can't predict everything, because I can put you on a blood thinner and then you can have a bleeding complication. So as surgeons, we're always weighing the pros and cons of one, of one thing versus another thing. And the blood thinner, giving people blood thinners with the cosmetic surgery is one of those things where some surgeries I do it, some I don't. For me personally, I had a few patients get blood clots in their legs from tummy tucks. And then after that, I decided I would rather have a bleeding complication than a blood clot. So now I personally routinely put my tummy tuck patients on blood thinners. But I don't do it with any other of my patients. Like no other group do I routinely do it. But for tummy tucks, I routinely do it. And that was after I had 2 patients get blood clots. And I just felt like a bleeding complication is the lesser of the 2 evils. So if your surgeon didn't put you on a blood thinner, that's not wrong. That's not wrong. So I don't want people like, I didn't get a blood thinner, so that's not what don't do that. It's not that cut and dry. So, that's the only thing, that's what I would guess is probably what happened to the first lady that I heard about, but I don't know for sure what happened to her. If she had an undiagnosed heart condition, that could have, the strain of surgery could have caused her to have cardiac issues the next day that could have caused her to die. I'm not real sure. She could have lost a lot of blood, but I doubt it. Usually with tummy tucks, you don't lose a lot of blood. She didn't get liposuction, so that's not likely. Tummy tucks are actually not a high blood loss surgery, even though you would think it would be. The only way you lose a ton of blood with a tummy tuck is if the person has issues with clotting, which, that's kind of a problem. Or if it was a person who had a really large pannus, in which case it probably wouldn't have been a tummy tuck they were getting anyway. It would have been a paniculectomy, and that's a different issue. But that lady wasn't big. She had already lost a bunch of weight, so that likely wasn't it. It was probably a blood clot, but like I said, I don't know for sure. That noise was strange. Okay, so then there was another lady who died, and I have no. What I saw, somebody said that This person was in the Dominican Republic. The first lady was in the United States. This other lady was in the Dominican Republic. She had gone there from the Bahamas, and they said that she had low blood. So, okay, whatever that means. So, I'm assuming they're talking about her hemoglobin level. And I don't know if she had a low hemoglobin level going into surgery, or if whatever surgery she got, which I don't know what surgery she got, if she lost a lot of blood. Sorry, y'all. Hey, Dr. Valika. So, I know it is a common thing. A lot of people who go to the Dominican Republic, they always get some kind of lipo, and a lot of times they get a Brazilian butt lift, but not everybody. But with liposuction, it is not unheard of to lose a lot of blood, especially if she was getting aggressive liposuction, or liposuction of a whole lot of areas. And if she started off with low hemoglobin levels in the first place and then got aggressive liposuction, then she could have lost too much blood, and that clearly is not compatible with life. You have to have blood. So, but I don't know the details of that either. And I wasn't going to talk about any of this stuff until I saw the post today in the group where the lady was like, she got life flighted to the hospital and had to get emergency surgery for a bad infection after a fleur-de-lis abdominoplasty. And then initially she posted a screenshot of her doctor, and it said he was an emergency medicine doctor. And I was like, ugh. But when I went and researched that doctor, it looks like that doctor is actually a plastic surgeon. I'm not sure why that page said that. One particular screenshot said he was an ER doctor, but it looks like the person she went to was actually a plastic surgeon. Now, the issue that I have with that situation is, why does she have to get her complication taken care of by... Uh-oh. Myla Rose is tripping, y'all. Hold up. Looks like she's having a bad dream because she's still asleep and making those noises. Here, mama. She's still sleeping and screaming. She's too little to have a bad dream. She shouldn't even know about bad stuff. Sorry. I'm not sure why another surgeon had to take care of her complication. That's kind of an issue in my mind. Like, if I have... unless she traveled to him. Now, that's a situation where that could have happened. If she traveled to him and she was back home when her complication presented itself, then that is a situation where I could see how that would happen. But I'm not sure. I don't know the details. I just pray that she's okay. I'm glad she's alive, and hopefully now that she's had her, issue addressed, she has a normal recovery moving forward. But the most disturbing thing that I saw was one of the people in the comments mentioning their surgeon, and she said the person's name, and I just went and looked it up, and that person is nobody's surgeon. That person is not a surgeon, even though that person calls himself a surgeon. The person is a family practice doctor, and under no circumstances should you be getting plastic surgery, not surgery, from a family practice doctor. That is not a surgeon. Not even close to a surgeon. It's the furthest you can get from being a surgeon, is being a family practice doctor. Family practice doctors are awesome and necessary, but they are not awesome for surgery. You should not be getting surgery from a family practitioner. And this person, their page, their website, all the stuff that they had listing their credentials makes it appear to the lay person that they are the most qualified to be doing these procedures on you. And the word that they use to trick you and deceive you is cosmetic surgeon. This person said they were trained and they're board certified by the International Board of Cosmetic Surgeons, and they are a member of the World Society of Cosmetic Surgeons or some crap. And they did a 2 years of training with these people in cosmetic surgery, and they were trained most likely 9 times out of 10, their 2 years of training were by other people who were not surgeons. So it was likely the blind leading the blind, because most real plastic surgeons won't just like show you, oh, here's how you do the procedure. Like, even if the person got 2 years of 2 years of cosmetic surgery fellowship, it takes longer than that to learn how to do plastic surgery. And the plastic surgery fellowships that are 2 or 3 years long, you can't do them if you haven't done a surgical residency first, which is minimum 5 years. So if a person does a 2-year if a person does a 2-year plastic surgery fellowship, that is after doing 5 years of surgical training in another surgical specialty. Family practice is not a surgical specialty. So if your doctor residency was in family practice, their residency was emergency medicine, their residency was dermatology, if their residency was in OBGYN, even though OBGYNs are still technically considered surgeons, that's not a specialty that you can go and do a plastic surgery residency from. So those are groups of people who under no circumstances could ever be board certified plastic surgeons, because the plastic surgery board wouldn't even allow them to take the test because they don't have the proper prerequisite training to make them a safe surgeon first. You have to be a safe surgeon first and then become a plastic surgeon. This is situations where you're putting yourself at a higher likelihood of having major issues. So a lot of these cosmetic surgeons do a lot of liposuction, and people think that that's okay because the liposuction incisions are really little. It's always just a little lipo, But the majority of deaths from cosmetic surgery comes from liposuction and Brazilian butt lifts. And the reason why liposuction is so risky and dangerous when you're in the hands of a person who doesn't understand because they haven't been trained in it is because since the incisions are so little, the majority of the operation is happening blindly. So if I'm liposuctioning your entire abdomen and my incision is this small, that means I actually can't see anything that I'm doing. I can only feel it with my other hand. So if you're going to have somebody blindly doing surgery, it should be a surgeon, not a person who's not a surgeon, because that's how people end up perforating major organs and stuff like that, because their understanding of the anatomy doesn't go beyond anatomy lab in the first year, in the first 12 weeks of med school. You want somebody who knows the anatomy in their sleep with their eyes closed, literally, because that's essentially how liposuction is done. Your eyes may be open, but they're technically closed because you can't see under the skin, and liposuction happens under the skin. Like, you can't visualize the stuff you're working on. So that's part of why the issue is, that's part of why there's so many more complications and deaths related to those types of operations. So I see Sabrina Bowers-Jones says, why are cosmetic surgeons allowed to do these surgeries? First of all, they're not surgeons, but a medical license is an unrestricted license. So if you're a doctor, technically, you can do whatever the patient signs a consent for you to do to their body. We do all this extra training. When you finish medical school, you can't practice medicine when you finish medical school until you get a full medical license, which you have to complete an internship to get a medical license. And then after that, we go down different pathways of training in order to become specialized in a particular area. And that's the reason why we have these medical boards, in order to make sure that down your track you are safe, ethical, and qualified to do that pathway. But that's not a requirement to practice medicine. So it's up to you. This didn't used to be much of an issue because most doctors would just stay in their lane, but nowadays that's definitely the issue. There's lots of reasons why doctors are practicing outside of their scope. And I'm not going to get into that. That's a whole nother topic. But the fact of the matter is, in 2018, what you have to do as a person who is concerned for their safety and life is verify that the doctor that you are going to is qualified to do what they're treating you for. Period. That's your job. Because doctors can do whatever they want to from a practice standpoint, on a person, because the medical license is an unrestricted medical license. So instead of being a victim after the fact, you need to be proactive before the fact to make sure is your job, is your responsibility to protect your own life, period. Today, 2018, you can't just trust that the doctor is doing the right thing. So if cosmetic is in their title, just go somewhere else. Because real plastic surgeons don't call themselves cosmetic surgeons. They call themselves plastic surgeons. That's the first step. Because these cosmetic surgeons, they will literally, they go hard in the paint for marketing to make it look like they're more qualified than real plastic surgeons are to do the job, and it's just bull crap. It's a load of garbage. And if you fall for it, you could end up dead. You could technically end up dead in the hands of a real plastic surgeon. Your chances of dying are much higher in a person who's not actually a surgeon. So you have to pay attention. So there's not, plastic surgeons and cosmetic surgeons are two different things. You want a plastic surgeon, period. So one thing you can do to verify that your doctor is a plastic surgeon is go to the American Board of Plastic Surgeons website and type their name in the physician finder. And if their name doesn't come up, pick somebody else. That's the simplest way that you can know that your doctor is a plastic surgeon first. Under no circumstances should you be getting surgery from a non-surgeon. And even though they call themselves a cosmetic surgeon, if their residency was in family practice, they are not a surgeon. If their residency was in dermatology, they are not a surgeon. If their residency was in emergency medicine, they are not a surgeon. They should not be doing your cosmetic surgery, period. Period. You don't need their license number. You just have to type in their name. That's it. The American Board of Plastic, the word plastic needs to be in there. Plastic, not cosmetic, plastic. The American Board of Plastic Surgeons website. Just type in American Board of Plastic Surgeons. It'll come up. Fat transfer to the hips is not as dangerous as a BBL. No. I told you, Sabrina, that dude is a family practitioner. He needs to be treating your blood pressure and your diabetes, maybe. And your anxiety or something. And if you have a cold, he should not be doing surgery. Oh, yeah, Kimberly Locke. So they do have to perform surgery in their office or clinic because they can't now. So cosmetic surgeons can't perform surgery in hospitals or the major surgery centers because they won't allow them to. Because, see, hospitals, they only let doctors practice in their scope. They won't let you say, oh, I do so-and-so, so-and-so. They're like, what did you do a residency in? Where's your case reports for residency? Like, you have to prove that you actually were trained in that. So they do it in their offices because they can't do it at an accredited facility because they're not surgeons. Yes, at a hospital, but these doctors aren't doing it. Heather Hendrick, they're not doing them in the hospital. Those patients aren't at hospitals when they have these issues. They're at the doctor's office or clinic or the OR that they built themselves with probably not even a real anesthesiologist. Or maybe they do have a real anesthesiologist who doesn't care about the fact that they are helping a doctor practice outside of their scope. Everybody's not ethical. Adrienne Wilson, I can't see your whole comment. I see you say, why do you think the more legitimate and qualified plastic surgeons do not speak up and demand that? I can't see anything after demand that. Sherry Johnson Ashley. Yes, people do brag on fake plastic surgeons. First of all, you call them dolls, and that's another one of my pet peeves. Okay, so we are not dolls. We are women, and we are alive, and we have heartbeats and souls. Part of the problem is that people are seeing themselves as dolls, and you're not a doll. You're alive. and that lady those two ladies that died this week, they weren't dolls. Dolls can't die. Dolls aren't alive in the first place. And that's the first major problem. We're looking at ourselves in this way. Like, I can't stand that doll thing. Like, I hate it. Because it's like dehumanizing the whole experience. And we're human beings with souls and heartbeats and families. Like husbands and children and brothers and sisters and mothers who miss us when we're dead from a BBL or a tummy tuck or whatever. I cannot stand how people call themselves dolls. You're not a doll. You're a woman. And that lady, those two ladies who died this week, were not dolls. Dolls can't die. Women can. So that's the first mistake. Yeah, I heard it was a few ladies that died from the Bahamas. I'm not sure what that's about. So someone asked earlier when I started, which surgery has the greatest risk, tummy tuck or liposuction? They have different risks, and they're both like with the tummy tuck. Like I said, if you develop a blood clot, and the blood clot moves from your legs up to your lungs, that can kill you. Liposuction, when people tend to die from liposuction, it's from loss of too much blood, from aggressive liposuction where people are taking out too much in one setting, or if they're getting fat transferred to the butt, like when they get the liposuction and then transfer the fat, people are dying from the fat transfer. And then in the hands of people who are completely unqualified, people may die from organ injuries like liver lacerations, splenic lacerations, small bowel injuries from bad liposuction. So, I mean, I wouldn't say one has a greater risk. They're both risky in the wrong hands. And I guess if you put the two surgeries next to each other and the person doesn't do too much liposuction, I guess technically you could say the tummy tuck is because of the blood clot risk, but most of the time people are getting too much lipo. Like people are doing a lot of too much lipo lately. Do you use drains on non-drain tummy tucks? I use drains on all my tummy tucks. Multiple surgeries on the same day is not necessarily a bad thing. It just depends on how many surgeries, how long. Having gastric bypass that's not likely the reason why she died. That really doesn't have anything to do with it. Okay, let me see. Oh, like to use Brenda, you said, is it okay to go through a residency program for surgery? Yes, actually that's a safe situation. So what happens with the resident cosmetic clinics, that's what we call it at my program. The person who's doing your surgery is a plastic surgery resident, which is a person who is doing plastic surgery day in and day out and has been doing it for at least a couple years, and they're literally doing nothing but plastic surgery all day, every day. And then the person who's overseeing them is a board certified plastic surgeon. So that's a safe situation. That's usually a pretty safe situation. Yeah, they call themselves dolls, Sherry, and I just hate it. Like, I don't think people are thinking. Like, I know people aren't thinking. It's like I did, I received an award yesterday, and when I accepted my award, I talked a little bit about like why I started doing these videos. I started doing these videos because I was seeing all these women who were putting themselves in really bad situations to get liposuction because it was cheap. And one of the ladies, like somebody on my Instagram, like rolled her eyes, like she did the rolly eye emoji, like, because I was saying, like, I feel like a lot of women are doing this stuff and they're disfiguring themselves to look like everybody else. And that's my opinion. Like, I think some of these surgeries that people get are disfiguring. Like, I don't like them. I'm allowed to not like something. That's my opinion. But what it looks like is the least of my concerns. Is more the fact that people are willing to put their life in danger and are actually willing to die to change the way they look, which is insane to me. Like, I don't think that's acceptable. I would not go to a surgeon or doctor who has people die on a regular basis for cosmetic surgery. I would not. And there's definitely things about me that I would like to make better. And when I do it, it'll be with someone who is ethical and has a safe track record. Like, I wouldn't be like, well, death is a risk. I wouldn't go to somebody if I actually thought I was going to die. Like, I wouldn't go to somebody to get these things changed if I thought it was a real chance that Myla Bennett, with my background, my medical history, if I thought it was a real chance I was going to die. Like, I wouldn't do it. I would just stay fat. I wouldn't do it. And somebody was so offended that I said that. It's like, that's the problem. No, 2 people died. Yeah, 1 died earlier in the week, before Friday, in the United States. Tummy tuck is not like having a C-section. It's very different. You can't always prevent a blood clot after surgery. That's the thing. That's one of those things that's just kind of bad luck. The only thing that could be done preventatively is if a person knows that you have a risk toward blood clots, to not do it or to put you on blood thinners. But you can't prevent everything. That's what y'all don't understand. Like, people are like, well, what do you do to keep this from happening? You can't always keep stuff from happening. The best thing you can do to keep things from happening or to minimize it is go to somebody who's actually qualified to do it. That's the first step. Somebody who was trained in it, because during our training, we are taught all the things we can do to minimize risk because it's elective. That's the best you can do, is go to a person that's qualified to do it. That's the best you can do. Kiara, I can't read the rest of your comment. It says the surgeon I want has it on his site that he can operate in the hospital but chooses to operate. Just go. Look, I don't know about, like, people lie, and I'm not saying that surgeon's lying. I have no idea. I don't even know who the surgeon is. But type their name into the American Board of Plastic Surgeons website, and if it's not there, pick a new surgeon. They make you wear compression socks to keep you from getting a blood clot. It helps reduce the risk of blood clots in MJ Washington. Good. If he's on the board site, you should be. That's good. Some surgeons build out their own surgery center, so if you get that's fine. If he's on the American Board of Plastic Surgeons website, not American Board of Cosmetic Surgeons, plastic should be in the name. If he's on there, that's good stuff. Oh, sorry, I'm covering my mic. Thanks for saying that. I said if he's on the American Board of Plastic Surgeons website, then I was covering my mic. My finger was on the bottom. Sorry, y'all. If Kiara, if he's on the American Board of Plastic Surgeons website, then you should be in safe, ethical hands. You should be. I can't guarantee anybody, but that's better. That's the first step. You need to make sure they're a real plastic surgeon. So that's a good sign that they're at least a real plastic surgeon. If your doctor was on there but he's not anymore, then that's a real plastic surgeon who just didn't, Like the boards, when you take the boards and pass them, you have to recertify. I can't remember if it's 7 years or 10 years because I haven't gotten to that number yet. You have to take a written test to like recertify, and some surgeons are like, I ain't taking no more tests, so they might not recertify. So that's not that's a real plastic surgeon who just didn't want to jump through those hoops anymore. But if they were never there to begin with, that's a major issue. Exparel is fine. It's fine. I don't use it, but it's not bad. The DR doctors are not on there usually. Some of them are. Some of them get boarded by the American Board of Plastic Surgeons. But I'm not sure the process to do that. But I can't tell you how to make sure a DR doctor is safe. I have no idea how to do that. Go at your own risk. I just know that a lot of badness happens there. So if that's you on your own on that one. I can just tell you how to check in America. It's not extra education. It's actually being educated in plastic surgery. It takes years and years to be a real plastic surgeon. A lot of years. And so it can't be reduced to a weekend, a month, or even a year. Like, it takes lots of years. So that's the people who are minimizing it, are the people who aren't really real plastic surgeons. And that's what they have to do in order to get people to pay them to do something they're not qualified to do. They have to trick you. I don't give recommendations for other surgeons, Brittany. I don't do that. I don't sit on here to promote other doctors. That don't make much sense for me to do that. There's a lot of deaths in Miami. Yeah. There's a lot. Miami is kind of the wild, wild west too. There's great surgeons in Miami, but there's a lot of whack jobs in Miami, and you just have to be careful. You don't want to go to a place where it's like a factory. You know, you don't want to go to a place where they're like turning over so many people in the course of a day. Because what you can be sure of, if the person has so much volume in one day, like if they're doing 7, 8 surgeries in a day, they're not doing all 7 or 8. One person is not doing all of those surgeries. You know, so you have to be wondering, are they going to really do your surgery, or are they going to get some tech to do yours? Like, yes, it is. So you don't want to go to places like that. And the places that are like that are the places that don't charge a lot. So they have to do a lot of volume to make the money they need to cover their overhead and actually turn a profit. So when people are looking for cheap surgery, that's basically what you're asking for, is a factory. Right. A plastic surgeon's office should not be in a shopping plaza. That's weird. It's not Payless Shoe Source. You know, it's not a lash bar. It's a surgery facility. It's beyond helping, Brittany. Like, they'll literally just have somebody else do it. They won't even be in there. They'll be in a whole nother room and somebody will be doing it. Helping is one thing. I can have anybody really help me. If I'm standing there and I'm actually doing a surgery, my 7-year-old can help me. I can be like, here, hold this. Like, it doesn't take much to help somebody. If I'm there, it's okay for almost anybody to help me. But the problem is that they're not there. They're in a whole nother room, and somebody who has no business doing surgery is doing the whole operation. And that's when livers get lacerated and all of this kind of business. Because these people don't know what the hell they're doing. Right, a BBL for $3,000, that is ridiculous and stupid. And nobody should be getting that. And if you want a BBL that bad, you need to be actually taking that money and going to a therapist to figure out why you think so little of yourself that you would Payless Shoe Source out your body. You need to be spending that $3,000 on therapy to get right with yourself. It depends on what the surgery is. Like, if I'm doing, I won't do more than 2 full lipo cases in one day. If it's like smaller areas, then I can do more. I could do a bunch of breast dogs in one day. It depends on the surgery, but liposuction is rigorous. It's physically taxing. So I won't do more than 2 of those in one day. It's just I'm too tired after the second one. $12,000 for lifting implants. Not really. Maybe slightly, but not really, because the implant, the breast aug is one surgery, and I know for me, like a breast aug is about 6,600. A lift is about 6,000. When I combine the two, I take a little bit off. That's not way too much, Brittany. It's not. That's how much a breast lift surgery. For me, if somebody comes to my office to get a breast lift, they're gonna spend about, with my surgeon's fee and the OR anesthesia, they'll spend anywhere from $6,000 to $8,000 depending on the size of their breast. And a breast aug is $6,600. So add it up. No, both at most. I wouldn't do both for $8,000. That's not true. See, y'all be listening to other people who don't know what they're talking about. Yeah, Brittany, you don't know what you're talking about, girl. I love you. Thanks for coming on my live. But you're wrong. So when people are in these groups telling folks stuff, then they be hearing this stuff and they end up in places they shouldn't be, because you shouldn't be listening to another patient. They don't know what they're talking about. That's an uneducated guess. Now, if you go to the DR, you can probably get it for $3,000. But a real plastic surgeon, that's a lot of work. A breast lift is a lot of work. And it takes time. So it actually depends on the size of the woman's breast, because the bigger their breasts are, the longer it takes to do the lift part. The aug part is not so much. Like, my augs are the same price regardless of the size of the person's breast. But the lift is not, because depending on the size of the person's breast, it will take me longer. And it depends on what kind of lift I'm doing. So if it's a periareolar lift, the one where it's just like the circle around the areola, now that would be less. That kind, that wouldn't be 12. But it depends on what kind of lift and how large the woman is. Exactly. So you can't say that's the thing when people are like, well, how much for this? I hate to give prices. The breast augmentation is literally one of the only things that just basically has one price for everybody. That's because the surgery is pretty much the same regardless of the size you are. But other surgeries, tummy tucks, I don't have one price for tummy tucks. It depends on how big the person is, if they're getting a fleur-de-lis tummy tuck or they're getting a regular one. There's some variables, and how long it'll take that determines the price. How much is a BBL, tummy tuck, MR, and liposculpture? $4,600. Oh my God, that is no, never. Why has psych evaluation stopped before surgery were approved by doctors? That's not That's not common to just have to get a psych evaluation. Everybody who wants plastic surgery does not need a psychiatrist. I'm not saying that. So if that's how it came off, that's not what I meant. What I'm saying is, if you are willing to get super cheap surgery, regardless of the risk, just because you want your butt bigger, that's a mental problem. If some doctor is having people die every week and you still go there because it's cheap, that's a mental problem. You shouldn't be like, well, somebody die every week, but I want a bigger butt and that's a risk of surgery. If it's really realistic that one patient every week is dying or one patient every month is dying at the hands of a particular doctor and you still go there, something's wrong with you. Period. I stand behind that. But just because you want plastic surgery doesn't mean you need a psychiatrist. That's not true. No, nobody should be pregnant getting a tummy tuck. What the heck? No, Lisa, I've never heard of that. That's crazy. That's malpractice. Yeah, like that's what when people try to get me to give them quotes, they'll inbox me like, interested in a tummy tuck and BBL quote, please. First of all, I'm not your slave. And I can't quote you without consulting with you. And don't send me your pictures because I'm still not quoting you without talking to you. Like, I'm just not doing it. It's not a hair weave or some jeans. They probably did do a pregnancy test and just didn't tell you. We run pregnancy tests on everybody, and we're not like, oh, the only way you find out, a lot of times the only way you find out you took a pregnancy test is because it came back positive, but they probably did do a pregnancy test. Yeah, we'll run that urine on anybody, honey. I'm just looking at see if I missed anything. Jack Henry. So she said, well, doesn't a BA include a lift? Absolutely not. Um, absolutely not. A breast augmentation takes 1 hour to do. A breast lift takes about 3. Like the full breast lift takes about 3 hours. I don't just do a lift. But that's what the consultation is for, to determine if you actually need a lift before we do the surgery. So then I will quote you on both if that's what you need. So no, that's not a given. Like no, that's two different, completely different surgeries. That was a good question. Thanks, MJ. Is it safer to do a small amount of fat for a BBL as opposed to a big amount of fat? It's not really the amount of fat for the BBL that makes it dangerous. It's where they put the fat. So the people who have died from Brazilian butt lifts have fat injected into the muscle, and there's large veins in the muscle, and so then the doctor will inadvertently inject the fat into those veins, and then the fat goes up to your lungs and suffocates you. If you were to move to a different state, would you have to be certified or licensed in that new state? You don't. So board certification is valid in any state, but that doesn't allow you to practice medicine in any state. So if I move to a new state, I have to get a license in that state, but it's just paperwork. So yeah, I've been licensed in Ohio, Indiana, and Georgia, and I still hold my license in Ohio and Georgia, and I let it go in Indiana. Yes, so Trelia, you said I was told I couldn't get a tummy tuck because I have fat under the muscle. Could that be possible? Yes. If you have a bunch of fat under the muscle and you get a tummy tuck, your belly will still look round. So you probably need to lose weight first. So where do you inject for BBL? So I don't do BBLs very often, but when I do them, I don't inject in the muscle. And actually, the American Society of Plastic Surgeons just issued a statement to all the plastic surgeons who are ASPS members, suggesting that we don't inject in the muscle because that's the only time people die from it is when it's injected in the muscle. So don't get that. Who does your lashes? Love them. Ava does my lashes. Her business is called Amore Beauty Studio, and she does my lashes every Tuesday morning. What is the max amount of time a patient should be under anesthesia and plan to discharge the same day? Okay, that's another one of those not a one-size-fits-all question. I personally I won't schedule a surgery for more than 5 hours of planned surgery, because the longer you're under, the more risk. But with that being said, being under longer doesn't mean you're going to have issues. Like, we do long surgeries all the time for all different types of things, not just plastic surgery. So, that's kind of I don't really have a direct answer for that. That's kind of different for different patients and the preference of the surgeon. I do lipo a lot. I do tummy tucks a lot. I've been doing a fair amount of breast lately. I used to do a lot of breast, and then it's kind of like stuff comes in like spurts. I do a lot of stuff. What's the disadvantage of tummy tuck then lipo versus lipo then tummy tuck? If a person has really loosey-goosey skin, then the lipo should be first. If their skin, some people's skin is just loose, like everywhere, not just on their belly. And like if your skin is really stretchy and you got like just looseness everywhere, you don't want to do your lipo second, because then you won't be tight anymore. Yeah, that's kind of my thing for that. Etching, that's a whole video. Like I need to just do a video about that. That's too much to talk about when I'm ready to get off, Margaret. So I will do a video about abdominal etching this week for you. So just stay tuned. I'm not about to start down a path of like a whole topic when I've been on for so long already. Yes, after 11 o'clock. So I will put that on my list, Margaret, and I promise you I'll talk about that this week, okay? Please don't call these people dolls on my video. Kashmir, you should watch my replay. I did a whole rant about calling women dolls. They're not dolls, they're women. All right, y'all. I'm going to Kashmir, catch the replay, sweetie. I'm going to go ahead and sign off. I want you guys to just be careful. I want you guys to go to real plastic surgeons. And just, be safe and smart about it as best you can. Yes. So, yeah, Kashmir, you're not a doll. You're a woman. You have a life and a soul and a heartbeat, and you can die. Dolls don't die. They're like inanimate objects. Yeah, you're not a doll. You're a human being. Okay, so I'm Dr. Myla Bennett of Adarabella Plastic Surgery and Medical Spa in Johns Creek, Georgia. You can reach me on my website at www.ederabella.com, or you can call my office at 678-325-0006. And you all have a wonderful night. Bye. Bye, Toya.